Hi guys, today's video is going to be about how I manage my cesarean section hernia without surgery, and I'll be discussing tips of how I went from this to this. So if you're interested in finding out more about that, let's hop right into it. If you're new here, welcome, and if you're a returning subscriber, thank you thank you for coming back. So like I said, we'll be discussing how to manage a cesarean section hernia without surgery using my personal experience as well. Okay, so moving right to it, what's a cesarean section hernia? A cesarean section hernia is basically a hernia that develops as a result of a cesarean section. So a cesarean section is usually done through an incision in the lower abdomen. So in that lower abdomen, the incision is usually about like 8 to 10 centimeters. It could actually really vary depending on the person's build and all, but basically that's the site through which they deliver the baby, and once they're done they end up preparing it, and that's what you see as your incision. Okay, so that incision scar, there could be a weakness along its line, and when that weakness occurs, it allows for the contents of the abdominal cavity to actually protrude through that weakness into the more superficial layers. So it could either be like fatty content, it could even be your intestinal tissue, which is actually not supposed to be there, right? Okay, so that's what actually forms the cesarean section hernia. So how do these hernias form? It could actually be because of poor wound healing, which could be from a range of factors. Maybe it could be from diabetes or a bunch of other things, like maybe a bigger body habitus, like maybe being a bit overweight could actually affect the tissue repair there. And it could also be because of the repair process. So maybe the person performing the repair wasn't quite thorough. That's something, but it's quite unlikely because that's something they take quite seriously. That's one. Another reason could be because maybe the suture snapped after the process, like after the entire repair process. That's something that could happen. The suture could actually just snap. Maybe it was a bit old, maybe it wasn't well done, and things like that. Then it could also be because of personal reasons. Maybe after a cesarean section you're a bit like hard on yourself and you're going extra miles and things like that, climbing stairs, doing heavy lifting, maybe even from a cough, a very heavy cough, or a very thorough sneeze after your surgery, or even vomiting or severe constipation. There are a myriad of things that could actually cause a cesarean section hernia. In my case, having had hyperemesis gravidarum all through my pregnancy, after I delivered, I actually felt that it was safe for me to eat and there will be no repercussions as a result of it, but that wasn't the case. Immediately I was cleared to eat and I actually took that first meal. I had this severe bout of vomiting, after which I felt a snap in my abdomen, and I discussed this with my doctors, but they felt that because it wasn't causing any change in my dynamics in terms of like my vital signs, and at the same time they couldn't see any obvious issue with the wound, they had asked that I just allow the entire process evolve and we see what comes out of it. So that was what caused the cesarean hernia, the cesarean section hernia for me. So what are those signs and symptoms that someone with cesarean section hernia can expect to see? So for me, I had noticed much earlier than these telltale signs and symptoms I'm about to discuss. I had noticed that there was a slowdown in the process of wound healing, and on the right side it seemed like it was a bit more tense, and there was a continuous ooze of serous discharge for weeks. And eventually when the discharge had dried up, it turned out that that area became a bit raised. But going forward over the weeks, I noticed that it became even more raised, coming into a lump. And I noticed that this lump actually got worse when I stood for longer hours, when I went on the staircases, when I carried anything heavier than my baby. I noticed that it tended to protrude more, or even when I had not had a bowel movement in a while, I noticed that it also tended to protrude more as well. Then apart from that, I noticed that it increased with coughing or with straining of any kind, so that's something else. I also noticed that it's reducible, so if you try to push on it, you notice that it goes back in sometimes. So that's one of the telltale signs of hernia as well. Another thing to note is that it might not be a lump. You might just feel like pressure, some heaviness around that area. That doesn't discount it as a hernia, because you can't necessarily see a very, very obvious lump. You actually need to go see your doctor, and then that diagnosis can be made for you. So that's exactly what I did. Even though I was thoroughly fully convinced that this was a cesarean section hernia, I went to see my GP and we had a chat about the signs and symptoms. She examined me as well, and from all of the things that we had discussed, she was able to make the assessment of a cesarean section hernia herself. But even more than that, she sent me for an ultrasound scan that further diagnosed the hernia, and we're able to see the size of the defect, which also helps when we're crafting out what the management would be. So in my case, the size of the defect was about 4 centimeters, which is like maybe something of this width, which is actually a bit much because it allowed for large amounts of tissue to come out. But actually with a smaller hernia, it's a bit more dicey because when those tissues come out, they might not necessarily be able to come back, and that's a problem. So it's actually a bit better. It doesn't sound better, but it's a bit better to have a larger size defect in some cases. All right, so after we had seen the result, we got into a discussion about what the management would be. So this is about how we actually ended up with the conservative management. So having looked at the wait list for surgery and also looking at whether or not my symptoms were dire, it might be stressful for me, it might be stressful for you, but in the grand scheme of things, do they affect your quality of life? That's actually what they're looking out for. And having seen that it doesn't necessarily impact on my quality of life to place me above people that have even more like dire reasons to have the surgery, that's the repair surgery, she would just thought to herself that it might be a long time before they actually get to me on the list, and it would be best if I start to put conservative measures to play and see how that helps me to manage things. So I'll be discussing those conservative measures with you now that help me to actually have that transformation you saw at the beginning of the video. So before I talk about the measures, I'll just like to say that I'm a doctor, but I'm not your doctor. So it's very, very important that if you have any one of the signs and symptoms that we've discussed, that you actually go see your doctor and have a proper diagnosis made for you, and even have a management plan crafted out, because this will help you to be really reassured that you're doing the right thing, and also keep your doctors in the loop as to what you're doing. Okay, all right, then moving on. So the first thing was actually abdominal banding. I'll insert like a picture of the type of band I used, and I didn't necessarily use the 3 wraps all the time. Most times I only used 1, or I used 2, but the entire aim was to prevent the tissue from actually coming through the hernia and protruding into the lump. So it was just to make sure that it was kept within the abdominal cavity and sort of like reinforce the guard in my abdominal muscles that were currently quite weak following the pregnancy and then the cesarean section. Okay, then the second thing was actually I tried the transverse abdominis activation. So it's kind of like that vacuum exercise that's very, very popular that a lot of people do to kind of like develop a tighter core. And this makes a lot of sense, because if you see the transverse abdominis muscle, it's almost like the corset of the abdomen. So if it's activated, if it's strengthened, you know, it kind of helps put everything back in place. So even with a hernia, it still does a good job in sort of holding the tissue within the abdominal cavity. So that was something else. Another incredible factor, or another incredible advice I received that was a huge factor in the transformation that you saw, was actually losing the weight. So if I had added more weight, it probably would have led to weaker muscle, and at the end of the day would have led to even a worsening of the hernia situation. But because I took that advice to actually lose weight, and this I did through intermittent fasting, I'll insert like the video where I discussed how I lost the 17 kg that I had developed. I'll insert a link so you can always check it out. Okay, so following that weight loss, I honestly noticed that there was like a huge reduction in the symptoms. In fact, now I barely actually see the hernia come out. I don't think I've seen the hernia come out in the last 6 weeks, and it appears that it has shrunken, it has kind of contracted, so it's not as big as the 4 centimeter defect that it used to be. So I feel like this has actually really worked. Another thing was plank exercises. So while there are some abdominal exercises that are contraindicated in these early days of having the cesarean section hernia, it's very important that you try doing plank exercises, because it still also activates your transverse abdominis muscle, keeping everything together. All right, another thing is to make sure that you take control of your gut health so that you don't have episodes of constipation that leads you to strain, further worsening the hernia. So I feel like all these things together is what actually helped me to get to this point where I don't feel the hernia, like in terms of like the intestinal tissue protruding through like I used to. I haven't had to reduce the hernia in at least 2 months, just because it hasn't come through the hernia, like it hasn't come into like the superficial tissue the way it used to previously. So those are things to help. Okay, so while you know all of this and while you're on your journey, it can still be very emotionally daunting, because I can imagine like you've just had a huge change to your body, and then at the same time you also come down with this hernia. So it just seems like there's so much going on at once. I think it's good enough for you to like open up to people in your space, open up to people in your family. Just don't hold on to it for too long. Don't keep it to yourself, because it then builds up resentment. And to be honest, this was something that helped you get your baby in good condition. So it shouldn't be something that you're feeling resentful or you're feeling regret about. So always just try and seek help, whether it's from a family member or a close friend or even a therapist. Just seek help to actually ventilate these emotions, okay? Last but not the least, while there are conservative ways of managing this condition, it's very important that you have that chat with your doctor to know if you're someone that falls into this room for the conservative management. Because in situations whereby the hernia is not reducing anymore, or is somehow obstructed, or the tissue within the hernia twists on itself, then you wouldn't be a candidate for these conservative measures, and in more cases you would need an emergency surgery. And you can notice this kind of symptom, or rather this change or this complication in the hernia, through symptoms like abdominal pain, vomiting, and maybe you haven't been able to open your bowels in days, contrary to what you were doing before. So it's very important that at that case you actually visit your emergency department and you get someone to review you, okay? If these tips have helped you, I'll be really excited to honestly hear from you, hear your story, hear how it's helped you and things like that. Please leave a like and subscribe. Thank you. Bye.